Good morning, it's your daily dose of complete health. My live function is working once again on my mobile phone, so here we are, back with you this Saturday morning. Just wanted to go through and we have had an incredible week here at Complete Health. It's been unbelievably busy. We've just done a summer special offer that many of you may have seen or have had friends that you've referred in. I just want to say a massive thank you to everyone that has sent their friends and family into the clinic. It makes a massive difference for our practice having so many referrals coming in. But we just, for the first time, and we're doing it this afternoon, for the first time, we are doing a completely free health class to the public on lower back pain and sciatica. It's the first time we've ever done this. We're doing our first ever lower back pain and sciatica free health class for the public. So what we did is we put an advert up on Facebook, must have been about a week and a half ago, for safe and effective ways to manage your lower back pain without the use of drugs and surgery. And literally within about 2 minutes of putting the advert up, we'd already sold half the tickets. And it's completely free of charge, but it is a ticketed event just purely on the grounds of we're not allowed to have more than 15 people in the practice. But why is it that so many people are taking us up on this offer on a free health class on how to manage your low back pain? Well, when we look at the most common cause for being off work, or the most common cause for disability in the UK, is actually low back pain. Now, about 80 to 90% of the general public will miss a day's work at some point in their life due to some sort of spinal pain and injury. Now, interestingly enough, about 90% of diseases on the planet that we know of are almost all stress-related of some description. Now, this is going to be really the basis of the conversations that we're going to be having in our health classes. But when we actually break it down to the causes of what really changes our health, it can almost come down to 3 things, almost always. Physical stresses that we put on our body, we're either moving too much or not enough. Chemical stresses that we're putting on our body, the things that we're putting in our face, e.g. our food, and the types of choices that we start to make. Now, I was having this conversation with someone yesterday that they'd heard of MSG and they knew it was bad for their body, but they didn't know why. Now, MSG was one of those additives that was put in food. It's a flavor enhancer, but it's actually a neuro enhancer. It basically stimulates your nerves. Now, if you put that in your body and you're already getting pain, it drives it up. So interestingly, people don't always think about the foods that they're eating and the chemicals they're exposing them to heightening their levels of pain. Alcohol heightens pain. Not getting enough water heightens pain. Now, these are all ways of chemically changing your body that can start to introduce pain, especially stuff like low back pain. And then the last one is emotional stress. When we feel stressed, our brain opens up the gate in order to help these processes so that we can sense the environment, so we know that when danger is occurring, that we get away from it quickly. This is why emotions sometimes help us, e.g. when we get chronically stressed, it's really bad, but when we're acutely stressed and our adrenaline levels drive up, it actually helps to numb us. But when you go into that period for too long, it actually starts to drive up certain factors that heighten pain. So these are the kinds of topics we're going to be doing. Now, this isn't going to be the only class we're doing. We're now actually going to be doing a multitude of classes. I've got one on Wednesday for all of my regular patients. We've got one on in a couple of weeks' time on headaches and neck pain as well. So if you're interested in learning a little bit more on how you can safely and effectively manage things longer term so you can take care of your health and not just rely on a practitioner or massage therapist or whatever that is for you, then let us try and help you get through that process. Patrick here from Complete Health. This is your daily dose. We'll speak to you again very, very soon. Take care for now.